the direct signs are the ones that are kind of gonna smack you in the face. What you're more likely to see are these indirect warning signs. So, is PATH warm? The acronym was created by the Substance Abuse and Mental Health Service Administration, and we're going to go through all of these. The first one is ideation. Rather than coming out and directly saying that a person wants to kill themselves, what a much more likely scenario is going to be is that the person's going to give hints, right? They're going to say things like, I'm tired of it all. I wish it was all over. I don't want to be here anymore. I just want to go to sleep forever. I feel trapped, or I feel like I'm a burden. They may talk a lot about death or about their own funeral. Substance abuse or dependency. I want to make this point one more time. Those who are addicted to drugs or alcohol are at very high risk for suicide. I would say it is the rule and not the exception for an individual who struggles with addiction and/or substance abuse to struggle with suicide. I was talking to Eric about this very recently. One person brings up suicide in a group, and all of a sudden, 9 or 10 hands are also talking about it. Yet me too. I felt that way at one point in time in my life. I felt that way in my addiction. I felt that way early in recovery. It is far too common, and people just don't talk about it. Not only does chemical dependency or substance abuse intensify risk factors, but it itself is a risk factor. A recent study out of the National Bureau of Economic Research concluded that alcohol and drug use increases the likelihood of suicidal thoughts and attempts. So just by itself, with no other risk factors present, it can make a person more likely to die by suicide. Purposelessness. A lack of meaning and enjoyment in things that people used to enjoy. So if you start to see individuals who, they were really into their work, they were really into sports, they were really into particular things in their life, and all of a sudden they're finding that they're not enjoying those things anymore, it's a cause for concern. But it's also, remember, a common symptom in active addiction. We talked about it as being part of that post-acute withdrawal symptoms. Anxiety. There is a lot, and I mean a lot of attention, on depression and it's linked to suicide, but not nearly enough attention is being paid to the link between anxiety and suicide. Dr. Jitendra Serena of the Netherlands compared a group of anxious patients with a matched group of depressed patients and found that suicide rates for anxious patients were equal to or slightly higher than that for depressed patients. Marijuana, alcohol, benzodiazepines, all of these drugs tend to either create or exacerbate anxiety in individuals when they are not acutely